is the actor an opportunity to say, well, I didn't quite understand what he meant about that in this table. Use clear and well-structured, organised approach. It's important to inspire confidence without being overconfident. So, when you're preparing for this exam, practice makes perfect. Practice your communication skills with your peer group. This is something you can do with your friends. Write your own scenarios. All the scenarios are based on what you do every day. You get a feel from reading the college website what the scenarios look like. And you can write your own scenarios for common clinical situations and practice them. A kid who comes and they haven't brushed their teeth, and you have to say to the parent they haven't brushed their teeth. A child who's always late for their appointment. Things that we see every day. A child who's not wearing their appliance is instructed. There's 1,000 you can think of in 2 minutes. Just think of that scenario and you can practice with your friends. Get your friends to simulate a patient and you're the clinician, and they can give you feedback about how they felt about you talking to them. Record, everybody's got their mobile phones, they like recording. So record yourself speaking to a simulated patient on a mobile phone so you can see what your body language is like. And sometimes you look on the phone and say, oh, I'm awful. And it's much better to be, unless you can see what you look like on the phone, you're focused on what you're thinking and what you're saying, and you see yourself on the phone and think, God, I look really scruffy, I'm not professional, let's be more dynamic. So it's helpful to see a recording on your phone. Okay? So I hope that gives you the flavour of what the communication is all about, and some advice about how to prepare for it. So we're now going to do a scenario. Richard is going to be the candidate. I'm going to be the actor. And John is going to stop and start the scenario and make some comments.
I will be marking it back.
Hello, Doctor, please. So let's have a little look at the communication scenario that we're going to simulate. So when you do the scenario, you will be given some information on a printed paper for the scenario. So for this scenario, the candidate will be told, you are seeing an adult patient for the first time. They've not been to the dentist for a number of years and they're getting intermittent toothache. No braces have been fitted yet, but another orthodontist has previously suggested a plan without extractions and suggested the duration of treatment would be 6 months. The patient is very crowded and you are unhappy with a non-extraction approach and believe that extractions are essential. The patient's medical history is clear, having been checked on the visit before. So your task during the OSCE is to explain the treatment plan to the patient to include fixed appliances and extractions, giving the reasons where appropriate. Okay? So quite quite a common situation.
Can I take your seat? All our actors are adults, and they can play adults. When we first ran these scenarios more than 10 years ago, they were playing children. And you've got somebody saying, yes, I'm a 7-year-old girl, and they look like Colin, it doesn't work, okay? So they will either be an adult who is coming to you for treatment, or they are the parent of the patient. So remember, when you're speaking to them, you're speaking to an adult, you're not speaking to a small child. Okay? So, our candidate can come through, please. My name is John Scully. I won't be taking part in the exam, but I'll be marking in the background. Please, current candidate. Yes, please. Hello.
Hello, Doctor.
Well, hang on a minute. Hello. How about, hi, I'm Dr. Cure. I'm here today as your orthodontist, and I'm dealing with some issues that we're going to discuss today. It's simple. Yeah, but introduce yourself in a friendly way. Hello. Oh, good. All right. Speak up. Depends what you guys are happy for video.
Yeah.
I don't mind. You show it with your comments. Just please do not put it online. That's all we ask.
So, what do you want?
Well, I've been to see an orthodontist and come to see you.
You've seen another orthodontist?
Hang on a minute. He's not given time for the patient to explain. It was halfway through a sentence, and straight away he's in there. The patient is explaining. He says, "What do you want?" Yeah, it isn't polite. It's very abrupt, and straight away he's interfering with how that patient is trying to give information. That's going to make it more difficult for you to prepare your plan. Please carry on.
So I've been to see other orthodontists. They said they could straighten the teeth without taking teeth out in about 6 months. I'm having some toothache. Will the braces make the toothache go away?
Mr. Melrose, I'm sorry that you've got a problem. I will deal with that.
Oh, was that empathetic? I'm sorry you have a problem. I'm empathetic to your needs. So when I'm marking this patient, this candidate, I will write in my marking box, empathetic in words, but not in body language. Empathy comes from what you say and what you do, as Colin said. So, yeah, I'm really sorry that having that as a standard stock phrase will not be enough in the exam unless you show the empathy within your actions. Well, you won't get those empathetic marks. So these marks are empathy within our marks. Thank you.
I promise you I can solve all your problems, but first, can I ask you some questions about your medical history?
Whoa. Who is teaching you guys to ask medical history? I don't know. You do not need to ask medical history at all. Yes?
Remember in the scenario when I read it out, it said that the medical history had been checked and there was no medical history. We see candidates time and time again during the precious 15 minutes of this Viva going through a detailed medical history when they're already told that the medical history is clear. If it says in your information that the medical history is clear, don't waste Viva time with that.
That's something that everybody seems to do. You do not teach. And if there is a medical history issue, it will be in the history. That's not what this test is for. Okay? It's about communication skills, not about how you manage a patient on a first new patient. Okay? That's correct.
So, can I just check the medical history again? So, you take the exam. you eat any sweets?
No.
So,
Doctor, can I ask a question? In our first meeting, you said that the treatment would take a long time and I need to have teeth out. The other orthodontist told me that it would be non-extraction and it would take 6 months.
okay, let me say, other doctor must be stupid. Everybody needs teeth out.
Right, let's start there. Professionalism. That will come, and I'm going to talk a bit about professionalism in general for the whole exam. Yes, we know patients get the wrong treatment. Yes, we know they get the wrong advice. So, okay, I'm giving you my advice as a specialist. I don't think that's appropriate, and there are many people who are some controversial areas, but I would say that that would be inappropriate for these are the reasons why. I can't comment really on why that dentist may have said that they think they can treat it non-extraction. Okay, but don't heavily criticise, but you don't have to agree with something that you don't think is appropriate for the patient, but you don't say to everybody, yeah, Carol.
So, your capillary analysis shows that your open incisor teeth are only 18 degrees to maximum
Sorry, Doctor. I don't know what's
Straight away, jargon, straight away jargon, and that happens a lot. Okay, jargon comes in because you're so used to speaking it, and in the next sections of the exam, we don't want jargon, we want technical information. For this section of the exam, that's irrelevant to the patient. Yeah, because you're interested. Well, we've looked at side X-ray of your teeth to show actually top teeth are a bit sticky forwards, bottom teeth are set back. That's causing a problem here. So, you know, I've got a piece of paper here. If I show on this X-ray, I expect your teeth to be here, and actually they're really sticky forwards. So
It's okay to use simulated prompts saying, oh, I've got your X-ray here, let's have a look on the screen. This is your top jaw, this is your bottom jaw, you can see the angulation of the top teeth, the angulation of the lower teeth. Be prepared to use your non-verbal communication skills to create the impression of a digital X-ray and point various things out to the patient.
I bet there's not one person in the audience here that hasn't gone to a patient. Use that. Use what you do every day. All right.
So, do you have any questions so far? So, basically,
Yeah, no time. Again, you know, saying the right things. Do you have any questions? But then getting straight in, not allowing the person to ask the question, not listening, focused on the event. All right.
Doctor, can I ask you, my profile, I've been looking at the internet and a lot of people talk about their profile for orthodontics and teeth out. Will it look different to that teeth out?
I can guarantee to you, I can promise you, your profile will look fantastic. You will look just how you want to look after orthodontics. It will not change after this.
So stop again here, because this is clinical, isn't it? This is about clinical knowledge. We know that it's a controversial area and there's likely to be some changes on the profile, particularly if the profile is intrusive. While we are not testing your clinical skills, if all the information you give to your patient is incorrect, that's still a fail. Communication is communication the right information in the right way. So you might be empathetic, you might be nice to the patient, but you give them all the wrong information. Yeah, there are no such thing as ceramic brackets, they don't exist. Only metal brackets can treat them, well, that's not correct. So it must be the correct information as well as imparted in a good way.
Doctor, I have a problem having dental treatments. I don't like going to the dentist. This is why I got toothache. You talking about taking teeth out, and I spoke to my friends and they have an injection with a gun to make the thing go round. I don't know if I'll be able to do that. I'm afraid of needles.
We have actually hundreds and hundreds of children and they have teeth out without any problems. That's nothing.
I'm really, really afraid.
Well, children have this thing. What is your problem?
That's true, isn't it? We know we treat hundreds of patients, but each patient is an individual. Yeah, and to be honest, my early career, I was
So, if I do have this treatment and take teeth out and get my teeth nice and straight, I hear about friends who've had treatment and their teeth move afterwards. Will my teeth move afterwards?
I give you a treatment, your teeth will not move afterwards. You will get them beautifully straight, and they will stay there for the rest of your life.
There's a bit of arrogance coming in here now. Okay? If only we could all say the only way to not see teeth move after treatment is to move away from the city where you do the straightening. Yeah, that's the only way. Teeth always tend to want to relapse. So that's the wrong information given in a way that is arrogant and will not steer the patient into the right treatment plan and thinking for the long term. So, two issues there. Thanks.
Sorry, Dr. Johnson, I'm still confused about what treatments I'm having.
So we will take 4 teeth out.
Yeah.
Best ones to take out would be this tooth number 4, this tooth number 4, this tooth number 4, this tooth number 4. Because
But
that
I'm
makes,
having pain from that molar.
well, get your dentist to feel it. Yeah, okay. So just take, maybe if it doesn't get better,
But the dentist said it might need to come out and I have 2 gaps.
Wrong information, doesn't care, not responding to the concerns of the patient, which are valid concerns.
well, we can, let's not bother. We can fix that with this. So some,
Dismissive body language, yeah, dismissive, yeah. Go away, go away. Not interested.
And a bit of irritation.
We do have some candidates that lean in and start to go like this at the patient. Remember, they're only that.
so we put fixed braces on top and bottom, and you will
What's a bit? Do you mean fixed?
glue braces onto your teeth. So
Can I take them off in place?
no, they are stuck onto your teeth for as long as it takes for us to get them straight.
I think we'll draw that to a file. I mean, Richard's a very good back candidate, isn't he? Yeah, you've definitely played Any comments, guys? Anything you want to bring out? Anything that you've been taught that we are telling you different? We are the lead examiners. I've been an examiner for 20 years. So we sort of know what we're talking about and we're the ones marking. So please, ask away.
I just want to make sure, is it okay to say I was introduce my name?
Yeah, absolutely. But what I wouldn't do is then ask the name of the actor. Yeah, you don't need to know the name of them or the child that they're there for. Or they're an actor. This is a simulated situation. My poor actor the other day was trying to make up a different name each time she was asked. And again, it's wasting time. Introduce yourself. I believe there's this problem. How can I help? So definitely introduce yourself. In terms of particularly, don't shake hands or anything. Keep a sensible distance between you and yourself. I had one candidate one year who had been taught that empathy was to touch the patient. And so they moved in their chair closer and closer. And by the end of the Viva, they were stroking the knee of the patient. Do you think they passed? It's inappropriate. Yeah. You need to keep an arm's length distance away. You can lean in. The meaning that shows that you're interested and you're listening. Do keep eye contact. Smile when they're happy and smiling. What's the smile when a bit more empathetic or something let your face show what words are saying. So yeah, absolutely, please introduce yourself.
Say we can present on X-ray. I can present on X-ray not there?
Yeah, absolutely. I've got the models of your teeth, or here is the scan that we took last time, so I can show you just how crowded things are. Actually, you can see that, you've got about 10 millimetres less space than you need. Yeah, we take out a tooth that's 7 millimetres, but with a 10 minute crowd, we need the 7 millimetres either side. So we're very, very crowded. So, yeah, you could say that there's props there, because you would have props in your room. Unfortunately, we can't really look at models and X-ray shows because we can't ship those around the world, and actually, it just slows everything down. We're ahead of time.
Do you want to have a quick run through with a better
No, I think the better candidate is just the opposite to Warhammer. Yeah, we've said that as we've gone on. And you guys tend to do and prepare pretty well for this part of the exam. Yes, people do fail each time on it, but it's with all the things that we've just shown you there. Sure. Yes, please ask.
Thank you. I'd like to ask, what is the patient status approach? Okay, I should be able to listen, but also what's
So they should do, they are well trained. So most of the actors are English speakers through the British Council, and the examiner is there to make sure that Viva runs properly. If we found that the Viva was unfair to you, we would mark accordingly and change the practice of that person for the next time. They have got the script. Okay, so for the first people in the morning, the actor may be referring to the script. All those questions were written down for Colin, and the actor has those questions. Yeah, they might branch off depending on what you give them, like we would invite that, but actually each of those questions is set down. So they're not there to, they are there to start the conversation. They may respond to some of the things we've said, but they're going to try and work their way down those questions. Now sometimes, you brilliant candidates are so good, so fluent, that we get to the bottom of the questions, and the actor's like, that is okay. So if we run out of questions, often if everything goes silent and you know there's no more questions coming in, as a candidate you say, you have no more questions now, I'm here, is there anything else you'd like to know about? Nearly always there's some braces involved. Would you like to know a bit more about the braces, about the fixed braces, about the risks of braces? So you can keep the conversation going if you want, but if the conversation's finished, it's probably likely you've already asked. You've already got down, hopefully you've answered the questions correctly, but you've gone down that list already. 10 minutes normally goes pretty quickly, and it's rare that that happens, but if it does happen, you can't just get up and leave and walk off and go, oh thanks then. I will say to the examiner, please, that's fine, just remain and take your seat. If you want to restart the conversation, that is absolutely fine. There is always some generic things that you can ask the patient that can generate a little bit more conversation. And to us that means you're friendly, we can see that you're empathetic and talking to the patient and want to reassure them about what treatment they're on. Does that answer your question?
So we have a limitation to speak.
Yeah.
And so, because we have people who are going to practice, we ask those questions.
They do, but they're not our actors. So our actors are very well trained.
We spend about an hour to an hour and a half at the beginning of the communication day training the actors on the scenario and training them how to pace the interviews.
Yeah, we're looking at the actors who've been with us a long time, so each time we come back now, oh, hi again. So they're very well versed in providing that. Yes, in the early days it was a little bit of a problem because some of the actors were trying to get an Oscar and were taking over Viva, but that's not what happens these days. So you rest assured the actors are very well trained and they follow the script to make sure that you get the lion's share of it. Yes? You asking a question? No? Anybody else? At the back?
If I make a mistake, I have to say jargon.
If you make a mistake, if you say something incorrect,
Something
jargon. Yeah. So they make, yeah, because sometimes you burst out with jargon just because it's in your head. And we appreciate you're speaking to somebody whose second language is in English, your second language is in English. We understand that, but our exam is in English, so you must converse well. But if you blurt out something in jargon, so sorry, what I mean by fixed appliance is cane-back braces, which you may have heard of, the squares on the teeth. Or you may not have noticed you said jargon, but our actors are trained to say the fixed brace. What is that? Just go, oh, sorry, I'm really sorry. What I mean is, that's okay. You won't then get a fail just because you use one or two things in jargon. You may not get the higher marks because our marking scheme says that occasionally uses jargon. If you use jargon for everything, that puts you down to a fail. But if the odd word is jargon, the majority of your talk is understanding language of the patient. Yes. If we have time, Collins has got a nice little video. If not, we will send you the link for YouTube on non-verbal communication. And that has a lot of hints and tips on how to behave. Yeah? Do this with your nose, nervousness, not looking at anything else. If we have time after the break, because it's playing the sound next door in there, we will try and play that video for you. If not, Colin will send you the link, because that is about the behavioural aspects. The words, fairly straightforward, they're all the opposites of what you say. And they vary a little bit on
In terms of professionalism, you're trying to create an atmosphere, an aura around you of appearing to be professional. Now, there's no strict rules about dress code for the exam, but if you are trying to convince the examiners that you're a professional person, if you've got ripped jeans on that are halfway down your legs and dirty and your appearance is very casual, it's more difficult for you in the exam to project professionalism. Okay? Now, there's not a rule about this, and there's difference in cultural norms about dress. But what I would say is that if you're trying to project a professional image, it's much easier for you as candidates to do that, not only if you're acting the role of being professional, but your costume for your act is closer to a professional role.
If we turned up today with shorts, t-shirt, pair of sunglasses, and walked around like this, take this as seriously with you. So, and if you went for a heart operation and your surgeon turned up in scruffy jeans, unkept beard, his hair was everywhere, so he's going to do your heart operation, you've got to look after yourself, let alone my heart. So, it's about how you present yourself to people. We've got a few points to make. I think we need to move on with the next stage. There is more Q&A, and you can come and ask us questions after. There's lots to cover today, and I want to make sure we cover it for you. So we'll move on to the diagnostic section next if we can. Thank you.
So, John,
Process.
yeah.
Candidate, you failed. Can you go and take the seat, please? It's very easy for us to do a really good Viva or a really bad Viva. What's difficult is to do a middle of the road Viva, to do a bare pass. And we've tried to simulate that before. We were either really bad or really good. So, but again, you've seen that now. Go and practice with your colleagues. Yeah. If you do a little practice with your colleagues, you'll soon start to have a bit of a laugh. I remember I did this with our registrars, and it was a patient who may need orthodontic surgery. And the patient said, so, are there any risks with surgery? He said, yeah, you might die. So, you know, things that you might blurt out, things that are incredibly wrong will upset the patient, you pick up. And the more you practice, the more you can take away the things that are bad, and you get feedback from your colleagues. This isn't a competition between each other. You're each judged on your own performance. My trainees do best when they help each other. Form an online group, form a WhatsApp group, share cases, share information,